move into our weekly COVID-19 Public Health Director update. And once again, Kathy's brought Jamie with her. Good morning.
Good morning. Okay. We handed out the data for as of the 23rd. So you can see the cases are, remaining pretty steady, the cumulative cases. So not much of an increase, both in Minnesota and in Clay County. Our death rate is still at 84, so that hasn't changed. A few more in Minnesota. And then the numbers of out of isolation correlate with the number of cases and deaths. Our active cases are at 51, so a few more than last week, but still really remaining low. And our case investigators and contact tracers are still working on those cases to follow up. They're taking those versus having the Minnesota contracted officials take those. Let's see, and then the age groups are still the same. Hospitalizations and people in ICU, we have a graph as well about that, but the numbers for hospitalizations are really remaining stable, and those in ICU as well. So not much of an increase. That's across the state. And our 14-day case rate is really low. It's at 14.33. We haven't seen it that low in a long time. Last week it was 21.34. So that's really great, that 14-day case rate staying down. And of course, that's the rate we worked with 12 as we followed that throughout this last year to help them make some decisions about what they were going to do as far as in-person and hybrid learning. So that number is really positive as we see it decline. The only changes with the case rates would be on the third page where you're seeing the county active cases. Now, of course, that'll change based on the number of cases, and that will vary depending on who's coming out of isolation, which cases are active. So you see the age range has changed a little bit from last week. So we're seeing it's, the 40 to 49 is kind of the highest range for active cases at this time. And then the 70 to 74 jumped up a bit too. So, and again, this graph is going to change based on the number of active cases every week that we have. Any questions? I went over those numbers pretty quickly. And then otherwise I can have Jamie talk about the vaccine administration. Oh, one last thing, the vault testing site is still operational, and again, they're continuing to operate that, and we don't have any notification of any changes of that or when they would discontinue those testing. But we're seeing around 1,600 in the last few weeks that their numbers of tests that they're doing. Around a little over 1,000 are the Minnesota residents. We're getting around 500 to 600 of other individuals, mostly North Dakota residents, and the percentage of positivity rate has been low, 1.35 the week of February 7th, and then the week of February 14th, it's 3.44, so that's been low and stable, so that's good. And it's good to continue that testing site, even though, we were up in the 4,000 to 5,000 range, but because of the low numbers that we're seeing, that's why we're only seeing about 1,600 or so a week being tested. But it's still a valuable tool for us to have in Clay County.
Kathy, before you proceed, Commissioner Mojo has a question for you.
Kathy, I know that we had talked about billing for the vault testing site, and that folks that went in would not necessarily be billed for that if they have insurance, to make sure to present that, and then they could work that through accordingly. My family tested in October for a variety of reasons, and we're now getting some of the statements from our insurance on that. And so it's my understanding that they'll bill insurance and then that'll be covered. What are we telling people about I mean, I don't want to deter people from doing that because it is quite an I think it's a $300 test. What are you hearing in regards to that?
You know, there was, we're telling people, and it's pretty clear that, and I can't remember if they have a sign up on that, in that vault testing site, but that there is absolutely no out-of-pocket costs. So we're very clear about that. I think it's listed on our website as well. But that if there's an insurance plan, that they would enter their insurance and then they can bill the insurance. If insurance doesn't pay, there's no collection of any funding from an individual. If insurance pays, it just gives the additional funding to continue to run this site with all of the members that they need to continue the site on a regular basis. So they will bill insurance. Insurance may or may not pay, but there should be no bill to an individual. We did work with, there was a glitch with Blue Cross Blue Shield of North Dakota. And so I connected the individual that is, she called from Blue Cross Blue Shield of North Dakota wondering about the charges. So I connected them with the Minnesota Department of Health folks that are working with the vault testing site. So they worked out a process for those individuals that are in Blue Cross Blue Shield of North Dakota. So what we're telling people, and we've gotten a few calls, and you might notice that on your insurance, but you should never receive a bill. Vault will not bill you. So there should never be a bill, and you shouldn't be paying anything at all. So hopefully that's been pretty clear on our site, on our website.
Thank you.
I just got billed for the administration of the vaccine, not for the vaccine, but for, I think it was, excuse me, $57 for the administration of the, you said you had over 300, but,
I specifically was talking about the Volt saliva test. Is that what you're?
oh, no, I'm talking about administration of the shots.
Oh, okay.
Sorry.
Yep.
Yeah, and I know providers they're able to bill an administration fee if they choose to. That's an optional thing. Of course, we are not charging an administration fee through public health, but some clinics would be maybe charging an administration fee. They have the option to do that if they choose to.
And just a follow-up, I realize that these tests and administration cost money, so it's not my intent to say that they're overcharging whether they are or not. I just think it's important for the public to know that they may receive these statements if they did supply their insurance card information, but that they won't be on the hook for it going forward.
Correct, yes. Thanks for clarifying that for the public. That's very good. Okay.
Okay, so looking at the vaccine administration and distribution data that we got as of February 20th, Clay County, the total number of people with at least one dose is at 7,940, and Minnesota-wide is 747. So for us, we're at 12.5% of the county population, and statewide, 13.7% of the population. Total number of people who have completed the vaccine series is at 6% in Clay County, 3,829, and 6.4% statewide. People age 50 to 64 with at least one dose, 14.8% of them, and then statewide 13.4%. And then people age 65 with at least one dose of vaccine, 40.5%, and for 41.7% statewide. And so there continues to be challenges on the Minnesota side for vaccine. I'm assuming North Dakota as well. The supply is our primary concern. Last week, Minnesota rolled out what they're calling the Minnesota COVID-19 Vaccine Connector. And that allows for all Minnesotans to register, basically, through the state vaccine. And they can sign up through mn.gov/vaccine connector. So they're calling it the Vaccine Connector. And they will, when they register, they will be alerted when they are eligible for vaccine. it will help to connect them to resources to schedule an appointment, and they will be notified if there's vaccine available for them in their area. So basically, what it does is it just alerts them if they're currently available, if they're eligible, and then it tells them who to contact. So as an example, if I were a teacher and teaching in Minnesota or a child care provider, and I completed that because I hadn't been vaccinated yet, it would let me know that I'm eligible right now, and in that case, it says to contact local public health. So that's what it's doing, is connecting them. If you're 65 or over, it would be your clinic or a pharmacy that may have vaccine in the community. So that's all on the map, where you can locate vaccine available on the map. So currently, right now, it's showing Sanford, Essentia, and Walmart Pharmacy are the.
And the flyers on the back, last page of your handout as well, so of the connector that Jamie just talked about.
So the other thing is the community vaccination program continues, and so they have a call center for people to be able to call to register. And again, that's if you're eligible, if you're age 65, and those sites have not changed. They're in the Duluth area, Minneapolis area, and Rochester area. And as far as what we have been, and then also, it's, just like Minnesota rolled out some vaccine to their partner of Walgreens a few weeks ago, they are now focusing on 10,000 doses to go to the Hy-Vee pharmacies in Minnesota. And then in Clay County, find my right notes here. Last week, we administered in public health 900 second doses and 200 first doses. And our plan for this week is a total of 1,300 first and second doses. So we have clinics today. We have clinics Wednesday, Thursday, and Friday this week. We did have a delay and had to cancel 100 people last Friday. We wrote it out till Friday, but didn't end up with our vaccine due to the weather delays last week. So we had to reschedule them, so it's a little heavier for us this week. And that's about it.
So, Jamie or Kathy, can we just spend a minute to maybe talk about what side effects might be that people might be able to expect? I know for first dose, there's been nothing but a sore arm type of thing, but, we're hearing about, maybe 5 to 10% of the people might be getting additional side effects with the second. Can we just maybe inform the public a little bit what you know about that?
It does vary, and because of those side effects with the second dose, some it's none, and some it can be a 24-hour kind of feel like they have a flu bug, fever, headaches, body aches kind of thing. Because of that, we're trying to juggle helping our partners that we're vaccinating so that all of their people are not vaccinated on the second, with the second dose on the same day, so we don't have a child care center that's completely out. But most people are feeling well after 24 hours. Anything that is out of the ordinary is reported to CDC through a vaccine adverse event report that we have done some of those because of significant side effects. And everyone who administers vaccines is required to report to CDC if there's anything out of the ordinary.
And we do recommend, Tylenol or ibuprofen if you, unless it's contraindicated for you based on some health conditions, you have some chronic health conditions, but a lot of people are finding relief from those medications with the fever, the body aches, headaches. Those are the 3 top complaints, chills.
But the main message is that it's can be common to have some side effects, and in most instances, it's nothing you should worry about.
Right.
And it should not prevent you from getting the second shot.
That's right.
Correct.
Yeah, it's unfortunate that there's side effects, but they're short-lived, and hopefully people don't shy away from getting the vaccine to protect them from getting COVID. That is longer lasting and certainly more problematic, so.
Thank you. Mr. Mojo.
Thank you. How does receiving the vaccine affect your ability to give convalescent plasma? heard some different stories in terms of how it affects the quality of the plasma going forward.
You know, I'm not sure, Jamie and I both were signed up for convalescent plasma like a week or two ago, and our appointments were canceled because they don't need the convalescent plasma at this time. They had enough in storage that they didn't want to take additional convalescent plasma. So that was interesting to us that they canceled both our appointments. So they apparently have enough supply at this time. I'm not sure in regards to the vaccine, how that affects that. We could check that out.
Any other questions for?
As long as we're talking about donating convalescent plasma, I'll throw in that we do have a blood drive the first week in March here. Not that you can donate the convalescent plasma, but to donate blood.
Thank you.
Anything else?
That's it.
Thank you.
Thank you.